Good afternoon. Welcome to the Pandemic Podcast with me, Dan Astin-Gregory. This is now take three, having had no sound for the previous episodes of the show. So here on tonight's episode, I'm asking the question, will the unvaccinated be exiled? It's a dark, gloomy and rainy afternoon here in Bristol, where I'm recording this from. And this episode, at least to begin with, will share similar dark, gloomy overtones. So as we explore this question tonight, will the unvaccinated be exiled? I'm asking this question in the context of the fact that we are seeing this steamroller effect in the world of COVID passes and vaccine passports, not only in the United Kingdom with the recent or farcical democratic quotation marks democratic vote in Wales. We now see vaccine passports and introduced in Scotland, Northern Ireland, and Wales. But what are the implications of this rise in digital surveillance? It's a very complex equation when it comes to moral codes of society, because underpinning all of this discussion is this idea that medical interventions are necessary in order to keep society safe. Now, any medical intervention may or may not play a role in physical health, but when you assess physical health, it has to be done surely on a case-by-case basis. But nonetheless, the scientific elements of this discussion are not for today. What I'm going to be asking is, will the unvaccinated be exiled? And I'm going to show you a series of what I describe as damning headlines from around the world about this concept of being unvaccinated post COVID-19, and whether you're choosing not to be vaccinated or you're medically unable to get vaccinated, what the implications will be or could be as a result of that choice or situation, which is unfortunately a situation that we're facing, whereby society is shifting in a very, very dangerous way. But I'm going to show you some of the headlines from around the world. This is quite. If you want to, I personally find these things deeply shocking. But it seems like humanity has kind of moved away from any sense of social duty towards looking after each other and not discriminating against one another. Though the counter argument is, of course, if you're not getting vaccinated, you aren't looking after your neighbor. But again, that's the scientific argument for another day, which I'll come to speak about more. But these are some of the headlines. Fauci calls for unvaccinated Americans to be banned from air travel. That's 80 million people in America banned from catching a plane if he follows through with those plans. Here, Breaking Bad actor Giancarlo Esposito message to the unvaccinated: go to a small island and sequester yourself. The idea that you round up all of the unvaccinated, put them in a separate place under the illusion that somehow will make the world safer. Quite frankly, if you want to buy me an island and all of my friends who have also been unvaccinated, well, feel free. I'm sure it'd be lovely. We could make a lovely little community. But the reality is, my point with all of these things is, I personally do not want to be segregated or stratified from society. I don't want to be separated from my friends and family and the rest of society purely because of my medical choices, especially as someone who's naturally immune to this virus, and many others who are too. But again, this isn't about the medical implications. This is about the social and ethical ramifications. We'll carry on here. But just to give a reflection of the kind of mindset across the world right now, make them pay. The unvaccinated have already cost up to $850 million in Washington state. I don't know how you can calculate that. But the idea of making people pay because they are not being vaccinated versus those being vaccinated, therefore they should pay for their medical care, is quite frankly ludicrous. Because think about all of the other behaviors that lead to things like obesity, considering alcohol abuse, people who smoke, people who have highly stressful jobs, people who enter drug abuse, all of these various factors that significantly place a burden on the healthcare system. And in fact, if you actually look at the data of those who have sadly succumbed to COVID-19, the vast majority of them are either obese or smoke. But where's the question, make the smokers or the obese pay? Well, you don't ask those questions because they are immoral. But it's okay to ask the same questions about vaccines, which is just, again, quite frankly, how society has entered this way of thinking is quite frankly shocking. Unvaccinated people attempting to enter a business will be slapped with a substantial fine. So being unable to enter a business, being unvaccinated, being fined for simply being a customer. Choices have consequences. Can you sue if an unvaccinated person gives you COVID-19? Can you sue if a vaccinated person gives you COVID-19? Why would you discriminate based upon the nature of the person that gave it to you? The reality is the majority of cases that we've seen to date have come from a whole variety of different people. But if you think about pre-2020, 21, where the vaccines didn't exist, well, all of the cases prior to that point came from unvaccinated. What are you going to do? Retrospectively sue? Unvaccinated meet the unsympathetic. Most inoculated Canadians are indifferent to whether the non-jab gets sick, meaning in Canada, based upon this survey, they don't care for their fellow humans' health, which is quite ironic because there seems to be a sentiment that, by taking this holier than thou ground of being vaccinated, you're a really caring individual that wants the best for society. Yet you're quite willing to allow someone else, based upon their differing choices, to get sick, and you're indifferent about their prospects. A slightly bizarre take on what it means to be a good citizen when you think in that way. Here in The Guardian, it's only a matter of time, this is an old article, before we turn on the unvaccinated. Poverty and enriching a class that the newly inoculated will become to resent. Just quite the world we live in, isn't it? Here's another article. I'm sorry, I did warn you this would be gloomy, by the way. In Bloomberg, the unvaccinated are a risk to us all. Right, we've seen that the vaccinated are a risk to some of us as well. The science will come to another time, as I mentioned. Unvaccinated footballers are putting lives at risk. It's time to stop picking. So if you're an athlete and you haven't been vaccinated, you might not be called up to the ludicrous. Let's look at the next one. If not getting picked for the football team is one thing, being denied a kidney transplant. Colorado has been placed as inactive on the transplant waiting list due to the fact she has not had the corona vaccine. So someone denied a life-saving treatment because she hasn't been vaccinated. It continues. Hospital system says it will deny transplants to the unvaccinated in almost all situations. So failing to be vaccinated means you're no longer considered an eligible patient for a transplant. But think about all those people who perhaps have abused their kidneys and means, regardless of they're vaccinated, but can do whatever they like as long as you've been vaccinated. You can live a life of alcohol abuse and put a great deal of burden on the system by living completely unhealthily, as long as you have a vaccine. It's simple as that. Multiple hospitals denying organ transplants to the unvaccinated. There's a warning sign here, by the way. This is what this is all about. I don't mean to doom and gloom on a Friday. I will turn to more positive note, but this is a stark warning. Unvaccinated care workers should get another job, says Javid at the weekend, because you've chosen a career in care because you want to support the elderly and the vulnerable. You've made your life to it. You've worked out the pandemic, and what we'll do is we'll reward you for that by forcing you to be vaccinated, or you have to get another job. Really, 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 really crazy, really crazy. It continues. How being unvaccinated against COVID can impact your wallet. Another form of coercion here to the economic loss. Just goes on to talk about how it's going to cost you financially. Choose to be unvaccinated, given that your health premiums will probably, your access to employment will likely be eliminated, various other adverse consequences. Here in Sydney, Australia, a loophole that allowed anti-vaxxers, by the way, they're labeling anyone that hasn't had a vaccine as an anti-vaxxer, to legally go to gyms from Freedom Day slammed shut by the government. Gyms had been told the classes to the unvaccinated, but no, they've now taken that privilege away. You're effectively a second-class citizen. And just because you've chosen not to have a vaccine, it makes you an anti-vaxxer, according to these lovely people. And so Biden talks up vaccine mandates and says unvaccinated autonomy have put our economy at risk. Right. How have the unvaccinated... politicians really need to look themselves in the mirror and recognize it's their policies, their lockdown policies, their draconian measures that they've undertaken, these ludicrous, unscientific mandates, shutting down society and economies, which have destroyed economies. And policies like we're seeing and talk like this that we're seeing will destroy the fabric of society. It's quite evident. And it's the powers that be that is driving this. New South Wales warns businesses against letting in unvaccinated people as Victoria overhauls COVID contact tracing. You're not allowed down, you're not coming in, you're not vaccinated, you're not coming in. The vaccinated should not subsidise the unvaccinated. Again, reference to the healthcare costs. Regardless of, you can live a completely healthy, and the fact that we're giving away donuts to people who have been vaccinated as incentive. It's all about what it's not about health, is it? Will a city mandate cause thousands of unvaccinated LA cops to walk off the job? We're about to find out. 40% of police officers in LA have not been vaccinated. So we're seeing care homes getting decimated. We're seeing hospital staff getting decimated. We're seeing law enforcement getting decimated. I'm sure the fire service will be next. Many of these essential services, which we value deeply, are going to get decimated because of these discriminatory policies. Here's another one. You can't see it right now, but it's about over 2,000 healthcare employees being suspended from their job for not being vaccinated. Fauci says COVID is no excuse to go unvaccinated, which I highlight this one. COVID could essentially disappear, and this idea that you should still be vaccinated will probably prevail, because it's not about the risk. It's not about the underlying risk. It's about this ideology, this moral duty to be vaccinated. This article, you can't see it. This is, did NBA players visiting face prison if they leave their hotel? Healthy athletes who've not had a vaccine and aren't infected with COVID-19 will be sent to prison for going out of the hotel. Just to remind you, all of these things I'm sharing with you are real. We're not in a collective hypnosis or dream here. This isn't some imaginary story that's just conjured up. This is real. You have to laugh, otherwise you're crazy. But this is mental. If someone told me 2 years ago this would be happening, I'd say you're absolutely off your rocker. You've been reading too much Brave New World. Or if you've been reading 1984 again. Italy gets tough on the unvaccinated, raising ethics questions. No shit, Sherlock. God. Trudeau bans the unvaccinated from leaving the country and earning a living. Thumbs up to you, Trudeau. Nice one. Next up. This little piece of science. We will talk about science another time around the ridiculous situation. But let's just, before I get to this article, and I hope that you've been able to see these articles on the screen, because I haven't gone back to my studio to make sure that you can. Let's just clarify one simple fact first in Common Sense Corner, by the way, which I haven't used that phrase for a while, but here on the Pandemic Podcast, we talk about Common Sense Corner. Strip it right back to very basics here in Common Sense Corner. In order to be a quote unquote risk to another member of society, you first have to be infected and infectious, and then around someone else in close proximity for a reasonable period of time in order to be a risk to them. Whether you've had a vaccine or no vaccine is irrelevant until the point of infection. So treating the vast majority of the society who aren't infected, who aren't infectious, with draconian rules is crazy. We've forgotten the idea that it's infection status, not vaccine status, that's the important one. Whether you're vaccinated is the key point, is not the key point. Whether you're infected is the key. But then, even if you are infected and infectious, who's actually at risk of COVID-19? And you look at all the data, you can recognize there's a very slim proportion of society that's actually at risk of severe disease. None of these things matter, by the way. Science, there's no point going into facts. Facts don't work. Facts are dead. Facts are dead. Science is dead. Here's another piece of science for you. Increases in COVID-19 are unrelated to the levels of vaccination in 68 countries and 214 counties in the United States. No relation between vaccination status and in COVID-19, according to this major study. There's another study which I unfortunately couldn't find, but it showed that the relationship between the volume of vaccines and the volume of cases was directly correlated, i.e., the more people that vaccinated, the more cases of COVID there were, which again contravenes all of the logic behind this thing. And it just comes back to the argument, which is that the primary endpoint is to reduce severe cases of the disease. Well, all of these articles are not about the severeness of the case of the disease. They're not about the individual's personal risk. They're about this idea of risk of infection, which fundamentally is neglected of the point that you first must be infectious. There's no reference of, and this idea, 10 stages of genocide. Let's look at this next. The reference that asymptomatic transmission, by the way, this idea that asymptomatically you can become sick. Well, there is some evidence that can occur, but it's negligible. It's very minimal, as is pre-symptomatic. The most common form of transmission is through symptomatic cases. So again, if you're sick, you may pass it on to other people. And it's whether you're sick which is the point. So here we are trying to basically erode society, force people out of their jobs. Now, the 10 stages of genocide, I bring this up because people don't think it's appropriate to make comparisons. But I just want to signpost a few of the stages. This is on the Holocaust Memorial Day Trust, by the way, in order to make sure that we don't go through anything like this again. But just look at some of these 10 stages. And it says there on the bottom right-hand side, genocide never just happens. There's always a set of circumstances which occur or which are created to build the climate in which genocide can take place. These stages may occur simultaneously or in a different order. Let's take a look at some of these 10 things. Number 1, classification. The differences between people are not respected. There's a division of us and them, which can be carried out using stereotypes or excluding people who are perceived to be different. Sound familiar? Symbolization, stage 2. There's a visual manifestation of the hatred. The Jews in Nazi-occupied Europe were forced to wear the yellow Star of David. Well, vaccine passports are a form of symbolization where you have to show your papers to enter society. There are also certain countries in the world which are actually doing some of these star-like imagery to show that you've been vaccinated. Discrimination. The dominant group denies the civil rights or even citizenship to identified groups, which we've just been talking about for the last however many minutes that I've gone on about this. So, dehumanization, those perceived as different are treated with no form of human rights or personal dignity. Well, we've seen in some of these stories that people are basically being reduced to some form of vermin. They are the great unwashed. They are anti-vaxxers by virtue of their choices. People are being dehumanized. Okay, so that's 4 stages. Number 5, genocides are always planned. Regimes of hatred often train those who go on to carry out the destruction of people. Well, this is becoming true in the sense that we're seeing businesses, as we've seen in the articles, being told that they cannot allow people who are unvaccinated into their stores. This is a very organized process. Stage 6, polarization. Propaganda begins to spread by hate groups. Well, we're seeing all of this propaganda effectively is, as I've just shown you, is all form of polarizing propaganda, creating an us and them situation, polarization. Stage 7, preparation. Perpetrators plan the genocide. They often use euphemisms such as the final solution to cloak their intentions. Acts of genocide are disguised as self-defense if there's an ongoing armed conflict or civil war. Again, this is slightly different here, obviously, significantly different. But nonetheless, this preparation phase is really about here disguising the vaccine passports, for instance, as a tool to reduce risk. It's a similar sentiment. Stage 8, persecution. Victims are identified because of their, in this case, ethnicity or religion, and death lists are drawn up. Thank goodness we're not at the death list being drawn up yet, but people being segregated into ghettos, well, we haven't quite seen that yet, but we're seeing people being excluded and exiled from society. It's very slowly happening, and it's until people actually experience it firsthand, they don't accept it, that it is persecution, that you separate society in such a way. But it will come to our shores, and you will face it. But the hard fact is, there's around 25% of people in the UK who've been unvaccinated. In terms of the adult population, it's 5 million adults, which is obviously a much smaller number compared to the overall population of close to 70 million. So if the vast majority are on the vaccinated list, then technically they don't see a problem because they've done their quote unquote duty. Therefore, by propagating some of these discriminatory mindsets, in many ways they become the persecutors, but the persecutors rarely realize that they are the persecutors when they are the ones doing the persecution. Stage 9, extermination. I really hope we don't go this route. This is where things really do get different. But I did ask the question several months back, how long will it be before people are jailed or worse for being unvaccinated? I'm sure there's probably already stories. I mean, there's already stories of these quarantine camps being built in all around the world at this stage where COVID is essentially, hopefully, in an endemic phase. And in stage 10, denial, the perpetrators or later generations deny the existence of any crime. It's already happening. There's a blanket denial that this is not an erosion of human rights. I quite frankly am so appalled to witness what we are witnessing around the world at this moment in time. I really quite am. And, whilst I appreciate it's very much contentious sharing those stages, I'm not making direct comparisons to Nazi Germany, but I am showing the precursors, some of these precursors which essentially underpin the behaviors that lead to this type of really, really damning exclusion of people from society. So will the unvaccinated be exiled? Inevitably, at the moment, it's happening. It's happening right now. It's really important. It's really important that we understand what is happening at this moment in time. And as such, if you are someone who has chosen not to be vaccinated or you're unvaccinated, it's really important you start to think about what actions you're going to take in the event that you are excluded from society. Most people won't realize what's hit them until it's hit them. I explained yesterday that we've launched the Together Declaration, which stands up against all of this to say we want to be together. We don't want to leave anyone behind. We don't want to discriminate. We don't want to exclude. We want to join arms, vaccinated, unvaccinated, to conquer this together, to create a better world. Yet we've only got 100,000 signatories, which is a good start. It's a good start. But if there's 5 million people vaccinated within a month or 2 months, many of those people could face a loss of employment, a loss of access to society, an inability to travel, an inability to go to the gym or other businesses. And the moment we get into the winter hysteria of COVID, it's only going to get worse. We are sleepwalking into a fractured society, and that's putting it mildly. So it's important that people now begin to mentally, physically, spiritually and emotionally and practically prepare for this reality. Um, because what we are seeing is a clear move towards removal of rights and liberties from those who choose not to be vaccinated. Now, for those of you who think it's only temporary whilst COVID is hanging around, you're deluded. I'm very sorry to say. I say that without judgment. But when we've seen other crises in the past with these types of digital surveillance systems and draconian policies, it's rare that they disappear fast. So at this moment in time, and this isn't just a message to the unvaccinated, this is a message to everyone, because it's your friends, your family, your colleagues that are going to be shut out. And you have to ask yourself whether you're willing to live in a world where the governments of this around the world have the right to decide what you put in your body, and as such decide whether you can access society. It could be a COVID vaccine today, a flu vaccine tomorrow. There's this this general idea that vaccines are generally safe and effective is basically the belief system that underpins all of this. But that's irrelevant, because it's not about the products, it's about the ability to choose what you put in your body. And right now we're seeing governments overreaching into our lives and determining not only what we put in our bodies, but what access we have to society. That's going to be very difficult to turn back from. And if you look at what's the trajectory that China has gone on with social credit type systems, where it's beyond just medical choices, it's about your entire behavioral set, which determines what rights you have. Now, people always look to other nations that are more extreme and say that will never happen to us. There are so many things that have happened in the last 18 months where people said that will never happen, deemed as conspiracy theories. Yet all of these conspiracy theories are more like accurate predictions of the future. And if you want to look at any digital identification industry reports, you'll see that it's multi-billion-pound industry in the making. And look at how many aspects of programmable IDs have been written about, social credit, all of these things, even the government papers, the documents talk about plans for this type of behavior. So, I mean, sorry, you are deluded if you think this isn't going to go on and on and on beyond just COVID vaccines. But also, you'll notice, as I talked about in yesterday's episode, we've got this term fully vaccinated has replaced double vaccinated. So you might be thinking you're sat there pretty with your double vaccination, thinking it's okay, I've done my bit. Well, no, tomorrow it could be 3. The next day it could be 4. The next day it could be 5. And how much more do you think your body can take? How much research has been done on how many doses of these things that you can take? Well, it hasn't been done. You are the experiment. You have to ask yourself whether you're willing to undertake this experiment, because it is an experiment. Undoubtedly, I'll get shut down for the fact checkers for this video, but it's important that we have the courage to talk about these things whilst it's still possible, because right now things are getting censored that should never be censored. We are living in a brave new world. The thought police are intervening with how we perceive life as we know it. So it's really important that we take heed of these things, and this growing attitude that it's acceptable to discriminate and exclude based upon medical choices. Even if the vaccines were perfectly safe and perfectly effective, I would still advocate for personal choice. Similarly, if governments decided to mandate fruits and vegetables, I would still advocate for personal choice, because it's not the role of the government to determine what one puts inside one. That should be an autonomy that the individual gets to decide. Now, this idea that those who are unvaccinated pose a greater risk to society can be debated, but we've lost all perspective. We've lost all perspective on the overall risk profile, the virus, how it's transmits. None of it's about the underlying science or risk. It's about social engineering now. So, number one, firstly, pay attention. Pay attention to what's happening. This is happening as it stands. So, firstly, there has to be a growing resistance against this. This is a yin and yang. This is light and dark. We need a peace that tackles the resistance and pushes back and says no. There are going to be protests, of course. The Together Declaration is one way. I've lost. I think I'm still here. So we have to resist on one hand, but on the other hand, we also have to prepare. We have to prepare mentally, emotionally, physically, spiritually, but also really be prepared if we cannot overcome these draconian policies that are coming down the track. Very key things that lost sound. Sound's gone. Sound's gone. Has it? Great. Lost audio. Lost audio. Really? Video, but no sound. Video being messed with. YouTube strikes again. Sound is gone. Fantastic. Too much.